Hi everybody, Dr. Perman here, Clinic Director of Nexus Brain Center at Life Chiropractic College West. I wanted to touch on another piece of equipment we have here called the tilt table. Now, historically, this piece of equipment is used in chiropractic for a technique called activator technique, using a spring-loaded tool to get movement in our spine. I talked about our spring-loaded device called Impulse in another video. Be sure to check that one out. But we do not use this table for that in our office. We use this table for what we call tilt table therapy. And tilt table therapy is beneficial for people that deal with something called orthostatic intolerances. Now, there are two types of orthostatic intolerances that we tend to focus on. One is called orthostatic hypotension. This is when you stand up too quickly and get kind of lightheaded and pass out. Now, on the other side of the spectrum, we have what's called POTS, which stands for Postural Orthostatic Tachycardia syndrome. These are people who, when they stand up, their heart starts to race really fast, and oftentimes those patients will fall or pass out as well. Well, we can offer rehabilitative options for those kinds of patients using the tilt table. So, this table will go all the way up, and it goes all the way down. And by having a very controlled way to lift the patient into gravity and out of gravity, we can retrain what's called their vasovagal response, or their cardiovascular system's ability to regulate their heart rate and their blood pressure appropriately, which is what goes wrong in these orthostatic intolerance cases. So the concept is this: we want to do some kind of therapy that activates what's called the pontomedullary reticular formation, or just the lower part of the brainstem involved in regulating vital function. And we will then also monitor their vital signs. So we'll have a pulse oximeter on them, or in an ideal world, we'll have constant blood pressure monitoring on them as well. Then we will slowly take them up into gravity as they do their therapies while we're monitoring their vital signs. This allows us to retrain that vasovagal response so that when people are upright, there's not as much dysfunction going on. Their heart rate regulates more appropriately, their blood pressure regulates more appropriately, their heart doesn't race anymore, they're not getting lightheaded, they're not passing out. Now, not everybody responds to tilt table therapy, but if you are dealing with POTS or orthostatic hypotension, it is definitely worth trying a therapy like this. And we can do this in office, but there are simple types of exercises you can do at home that might not be quite as effective as this, but can get you where you want to go. So if you're living with POTS or orthostatic hypotension and you need help, definitely leave a comment below. We are happy to chat with you further about non-invasive solutions to help these nebulous conditions.